Welcome to my capstone presentation, Nursing 676 with Dr. O'Donnell, Excelsior College. My name is Melissa Penner, and I chose Teach Back as my project presentation because the most vital role that nurses have today is patient education. With healthcare costs continuing to climb, there is a need to institute interventions to lower these costs. It is said that an informed patient is more engaged, healthier, and less costly. In order to ensure that patients are retaining their health information, nurses need to go beyond the basics of reviewing concepts and self-management techniques with patients during education. Patients need more than just their education printed on a sheet of paper and handed out at discharge. The Teach Back method has emerged as a key approach in supporting patient education. It is an evidence-based health literacy nursing intervention which promotes engagement, self-care, patient satisfaction, and age caps. This capstone project addresses various issues the nation is facing, including the rising number of Americans developing heart disease every year, the increasing healthcare costs, and the urgent need for improvements in patient education. Applying the Teach Back method during patient education and discharge, I believe, is the elite solution to these issues. This is a growing problem because in the United States, there's currently 85 million individuals living with cardiovascular disease. This disease is the leading cause of death in Americans and globally. Cardiovascular disease can cause many other serious injuries, disabilities, illnesses, which lead to billions of dollars in medical costs every year. Healthcare costs associated with heart failure in the United States is currently $320 billion. By 2030, the projected cost could rise more than $818 billion as reported by the American Heart Association. However, rising costs will not stop there. By 2030, the cost of treating cardiovascular disease could be more than $1.1 trillion. When it comes to heart failure, we currently have 6.2 million Americans that are suffering. By 2030, that rate could rise to over 8 million. Heart failure is the most common reason for hospitalizations, with over 900,000 admitted every year. A 5-year mortality rate of approximately 42%. This means the annual cost of heart failure is $45 billion. By 2030, this will be above $53 billion. The stakeholders affected by the climbing prevalence of heart failure and the associated costs include patients and their families, healthcare organizations, the healthcare providers, nurses, taxpayers, insurance companies, and anyone living in the United States population. Patients and their families are affected due to the lack of understanding surrounding heart failure disease. This can affect their desire and readiness to learn about it. Patients also hold responsibility for their own health and controlling cost. Society is affected by the burdening cost of heart failure, limited healthcare resources, and the escalating prevalence of heart failure. Healthcare providers and nurses are affected by the challenges of treating heart failure, which include establishing treatment plans, educating and managing medications in the most cost-effective manner. Insurance companies' cost containment efforts are playing constraints on treatment and medication by requiring prior authorizations. These authorizations are very time-consuming barriers to appropriate care and often lead to denials. Healthcare providers are essentially the gatekeeper between insurance companies and advocating for effective patient care. Teach Back is a very powerful communication technique. It involves asking patients to recall and explain and demonstrate important medical information that was provided to them by nursing. Teach Back provides effective learning, allows assessment of the patient's comprehension, and can test the recall. Teach Back enhances patients' knowledge. So who is the most affected groups and populations? The CDC reported that every year, approximately 647,000 Americans die from heart disease, and within 5 years of diagnosis, 50% die. In 2019, the CDC also reported that 18.3% of deaths in the American Indian populations were related to heart disease, and held the lowest percentage when compared to Asian Americans, which was around 21.4%. Black non-Hispanics was 23.5% and Hispanics were 20.3%. African Americans developed heart failure at higher rates, 30% more likely to die from heart disease when compared with any other ethnic groups, and are 1.5 times more likely to develop heart failure than whites. Hispanic heart failure rates are lower than African Americans. However, African Americans have higher rates than non-Hispanic whites and have higher BMP levels when compared to whites or Hispanics. Another reason why I chose TeachBack for this project was because up to 47% of patients reported that they forgot their medical information after leaving the hospital. 40 to 80% of medical information patients are told by the providers is forgotten immediately, and nearly half of the information retained is incorrect. There are multiple studies showing that the TeachBack method, when used, will lower readmission rates at least by half. Nearly half of all American adults have difficulty understanding and using their health information, and are at a higher rate of hospitalization due to emergency services among patients with health literacy. Limited literacy can lead to billions of dollars in unavoidable healthcare costs. The first theory that provided a foundation and supported the Capstone project was the Kurt-Lewin's change model. This is a powerful change management tool that nursing can use. Lewin's change model referenced stagnation means decline, and he developed a 3-stage change model noted as unfreeze, change, and refreeze. Change can be difficult to implement without following the correct steps first to prevent resistance by nursing and allow acceptance. The unfreeze stage in this project is the let's get ready for change stage. There is evidence-based literature that supports a need for change in nurses' current practices in order to assist in lowering healthcare costs. The change stage in this project is also called the implementation stage, which involves nurses receiving a teaching session that also promotes evidence-based literature supporting the change. During the change stage, the project aims to empower nurses to change their current practice by including TeachBack during patient education and discharge. The last stage is referred to as the refreeze stage. This is also known as the making it sick stage. This capstone project will provide nurses with references and resources to anchor the change into their everyday practice. In addition, an evaluation survey form will identify the nurse's willingness and likeliness to accept and use this change in their everyday practice. So how will using TeachBack benefit heart failure patients? A well-informed patient is more engaged, healthier, and less costly. A well-informed patient promotes adherence and self-care. They also have improved outcomes and are less likely to be admitted. Another health promotion model that also relates to this project originated from Nola Pender. The model aims to increase patients' level of self-care and well-being, which is very important in those suffering from heart failure. A care program was based on the Pender model, was developed to promote healthier behaviors and self-care. The findings in this program prove that efforts to promote self-care in heart failure patients provided better outcomes, better treatments, improved heart failure knowledge, greater adherence to medications and preventative measures, and longer life expectancies. TeachBack during patient education will improve outcomes in all of these areas. 10 things that nurses should think about when using the TeachBack method. Nurses need to use a caring tone of voice and attitude. They need to display comfortable body language and make eye contact. I always recommend sitting at the patient's eye level. Use plain language, non-shaming, open-ended questions. Ask the patient to explain back in their own words. Avoid asking questions that can be answered with a simple yes or no. Emphasize that the responsibility to explain clearly is on you, the provider. If the patient is unable to TeachBack correctly, explain the information again and reassess. The first outcome for this project was nurses will understand how using teachback during patient education will improve health outcomes and lower hospital readmission rates. The second outcome was nurses who use teachback during patient education will promote opportunities for improved patient satisfaction scores, self-management, and knowledge within the organization. The last outcome for this project was nurses will use teachback to promote strategies that uncover learning gaps and promote opportunities to address misunderstandings and individuals' learning needs. The teachback process. Educate the patient. Explain self-care, expectations of care one's home, and their discharge instructions. Then provide teachback. Ask the patient to explain and demonstrate how he or she will perform the recommended treatments, monitor for heart failure symptoms, and take the prescribed medications. Next, it's time to assess. If the patient cannot explain or demonstrate what he or she should do, or if the patient does so incorrectly, the nurse should assume that the patient did not fully understand their instructions. The teachback process continued. Repeat. Reintroduce the information that you previously presented. Consider the following. Use a simpler language. Make sure their medical information was given to them in their native language and at a 4th grade reading level. Break up the information into smaller segments, allowing the patient to focus on the information that they did not understand. Then reassess. Ask open-ended questions until you feel confident the patient understands the relevant information you wanted to convey to them. Nursing has the responsibility of staying up to date with evidence-based practices as they support and promote decreases in readmission rates and cost. Patient education and discharge planning are crucial aspects of all patient care and should include emphasis of using the teachback method. This method is imperative because it allows nursing to know if their patients understood and retained the information correctly once outside the hospital. Nurses who failed to educate patients properly prior to discharge would be considered poor practice. However, the teachback method can ensure effective education and identifiers as a cornerstone in patient education. This project took place in an intensive care unit where heart failure readmissions occur way too often. The nurses have voiced their concerns on improving patient education within this unit. The education nurses provide to patients should be congruent with evidence-based practices research along with supporting evidence. The teachback method is a beneficial education strategy that improves the quality and safety in healthcare and supports health literacy. Teachback is a feasible, non-complex skill-based intervention that is an expansion of basic foundational nursing skills and can be easily integrated into your everyday practice. It is up to project leaders and educators to present the evidence-based literature to entice nurses to make teachback a standard of practice and play an important role in creating an environment that's conducive to learning. Cautions for nurses when using teachback. Avoid using these common mistakes when using teachback. Quizzing the patient at the end of the examination or conversation. What's clear to you is clear to you. Using medical jargon, technical terms, or language that you think the patient will have difficulty understanding. Don't appear rushed, annoyed, or bored when using teachback. Ask patients questions that require only a simple yes or no will not work. You cannot use questions like, do you understand? Do you know how to use this device? Do you know when to take this medication? Or do you understand your treatment plan? This will prompt the patient to say yes or no and not give a clear explanation. Here's an example of some open-ended questions to use. Can you tell me in your own words how you will take this medication at home? Can you tell me when your follow-up appointment is? Tell me 3 signs of heart failure. Please show me how you will check your blood pressure at home, using words like tell me, show me, or can you explain to me will allow the patients to give you an open-ended answer instead of answering yes or no. Let's take a moment to discuss medical jargon. Things nurses should avoid saying are words like dyspnea on exertion. Instead, I would say shortness of breath. Weight gain from fluid retention will not be understood. Saying weight gain from fluid buildup may be better. Edema in your lower extremities. I would say swelling in your feet or ankles. Fatigue. I would tell the patient you may feel more tired or have no energy. Difficulty breathing when supine. A nurse should say it's harder for you to breathe when you're laying flat. Words like pulmonary edema can be very overwhelming. Instead, I would say you may have a congested cough with some pink sputum. As part of my presentation, I wanted to do some role play to help nurses demonstrate that they understand how to use the teach-back method. This is the example that I used for the role play. I used a female who has a history of heart failure, who has an EF of less than 30%. In preparation for her discharge, how will we implement teach-back? I'm the nurse, and my colleagues in the audience was Miss Miller. For this, we use questions like, tell me how you will weigh yourself every day. I'm going to review your medication list and explain to you what each one is used for. What is the name of your water pill? The patient says, I do not remember. This prompts the nurse to re-educate and ask again. The nurse could say, what concerns do you have about taking your heart failure medications each day? The patient may say, I'm not really sure. I'm just making sure I take the right ones at the right time. I then prompt the nurses to say how it's a good time to go over the times the medications are due and talk about ways to help Miss Miller remember, like setting alarms on her phone or having a daily calendar next to her medications. I find these examples were very helpful to the nurses during the presentation. The presentation took place in a cardiac ICU. There was 28 nurses who all either came to the teaching session or did all the information online. This is the teach-back evaluation survey that I gave to the nurses. I asked them to rate their satisfaction with the session, the quality of the information, if it was relevant to them, if I was prepared for the presentation, how comfortable they felt in using the teach-back method, and how likely they were to use it in their everyday practice after attending my session. These are the results from the surveys. How comfortable do you feel in being able to use the teach-back method now? I had 47% of the nurses say very comfortable, 32% said comfortable, 16% said somewhat, and 5% said not comfortable at all. I then asked nurses how likely they were to use the teach-back now in their everyday practice. 42% said always, 37% said very likely, 11% said likely, and only 5% were unlikely or never. I also found that 89% of the nurses strongly agreed when they were asked if they would like to learn more about this teach-back method or if they would attend another teaching session on teach-back in the future. I also had the nurses rate their overall satisfaction with the teaching session, with the information presented, was it easy and relevant to them, and was I knowledgeable when I provided the education. My capstone project identified that there is a need for improvements in patient education. The only way to ensure the teach-back method would be beneficial to an organization, its patients, and family is to start with the nursing staff because they are the forefront in delivering it. The project proved that when nurses are educated properly on using and performing the teach-back intervention, they are more likely to use it in their everyday practices. This allowing the opportunity to lower heart failure readmission rates, lower penalties, improve health literacy, decrease healthcare costs, and promote quality patient care.